This was the first statement that came out today after we heard that the government was in touch with nurses and sorting it out so that we'll have a controlled, well-controlled environment. There's always these negotiations that occur when government is in a tussle with organized labor and et cetera, et cetera. But this was the first one that came. It says that the full implementation of nurses' demands will add 2 billion to the country's budgeted expenditure. Deputy Minister of Finance. That's what he said today. So he's telling us that in June of 2025. I'm not sure what he wants us to do, because if it is true, and I believe him, if it is true, then this information should have been available to the government of the National Democratic Congress during the transition period, because that's what really transitions are about. At the transition, you will be told that there's an agreement that is going to happen, and that agreement will generate X amount of debt for the government that needs to be paid. So he's saying that now. Well, many people were arguing on this on all the platforms, and I was watching the Presec platform, I was watching the Disadel platform and the Accra Academy platform. And the conversation now, these platforms are of people who are between the ages of 42 and maybe 55, I think. And in the conversation, everyone was asking that, is that a cul-de-sac? Is he indicating a cul-de-sac? Is he indicating the end of a conversation? Because is he saying that the government says they cannot do it? They cannot. It will not happen. Is that really what he's saying? We're not so sure whether what he's saying, but that was the conversation. But it appears that that's what he's saying. That, I mean, can government really say that to to organized labor, to tell organized labor in the form of nurses that, hey, the money you want is too much, when it is not it's not a request. The money that the nurses want is not a request. It is arising as a result of a negotiation. Negotiations occurred, and that's why the money has come to that level. Whatever they're asking for, which they'll be telling us in the studio in a minute, it's as a result of negotiation. It's not a request. So negotiations with government, and the government is a continuum. Government is a continuum. So the government of the MPP and the government of the NDC are all the governments of Ghana. So government is a continuum. So the MPP government concludes a certain agreement with nurses. The NDC government is obliged to extend it, implement it, unless they can renegotiate with the nurses. And the nurses said that we are not about to renegotiate. Questions have been asked that why is it taking so long? It's taking so long because there was a court case about it, which court case was eliminated sometime in January. So this was very worrying. Then came the health minister, whose point was even more worrying. The health minister's point was even more. No, what did he say? Let's put what he said first, and then we can have the video. The health minister said that the conditions as required, not this one, where he talked about extra retired nurses coming, but let me read this as well. It says, the conditions as requested were not captured in the budget, and implementing it now will throw the economy off. The gains of the gold board, was it captured in the budget? Honorable Health Minister, the Honorable Mita Kando, the gains that the government has made with the gold board, was it captured in the budget? Or why are you turning it upside down? Okay. It wasn't captured in the budget, but you have told the people of Ghana that as a result of your ingenuity, can you change this? It's going to disturb viewers' eyesight. Can you make it straight? Sorry about that. In the mind of Ghanaians, you have told Ghanaians that, okay, I'll keep this. You've told Ghanaians that the gold board made gains that you were not expecting. All of us have been excited by the significant gains of the Ghanaian cedi against international currencies. The government has taken credit for that. So that was not expected. You've told us that has happened. And then you come and tell us that, oh, this one was not part of the budget. What is there? What are governments supposed to do? Governments are supposed to solve problems. If there's a disaster today, would you tell us that it's out of budget so the people whose homes have been flooded should stay in the water? Government doesn't talk like that. Government doesn't tell labor people that what you're asking for is not in the budget. Doesn't mean that you cannot do it. And then the minister comes later on and says that we should get retired nurses. And all over social media, it was just a funny joke. These days of AI, people created so many things. Let's take this camera and see whether we can see it well. Look at what people put on social. I'm sure this was created by AI. But look at what people put on social media. They are saying that you say we should bring in retired nurses. Okay, these are the retired nurses. How are they going to do the work? Nursing is for people who are fully fit, who can walk around the ward and engage with patients. Yes, the intellectual is very important. So such nurses who are retired can always give intellectual support. But you don't call them in when there's a strike. When there's a strike, you can call the military or you can call the police. But you don't say retired nurses who are above the age of 65 and they should come in and with their walking stick or come in as, 65-year-olds who may not be that strong, come in and go from ward to ward, patient to patient, doctor to doctor, and support what? I think that's really a bad statement to make. That's a very, very disingenuous, for want of a, to resist the temptation to use a harsher word. We'll just say it's disingenuous. It's disingenuous for any minister of health in any country in the world to say to nurses who are on strike that if you're on strike, I'm going to call retired nurses to come. That's completely disingenuous. Minta Akando should learn how to communicate as a minister. This is no longer opposition. This is government. You represent the government and the state of the Republic of Ghana. You are a minister. What comes out of your mouth is what has come out of all the mouth of Ghanaians. You represent a cabinet led by John Dramani Mahama. You have to be careful the kinds of things you say. How do you tell the general public that if the nurses are on strike, bring retired nurses? What kind of, are you Idi Amin? Idi Amin is always to talk like that. Idi Amin, we all grew up laughing at him. Idi Amin talks like that. And then, it says, go and do this, won't do that, go and do this, won't do that. Idi Amin talks anyhow. You are a young, modern minister for health, and these are the things you say that you are going to bring retired. If your mother was a retired nurse, Minta Akando, if your mother was a retired nurse, and she's 78, and she's at home, would you bring her to the ward when nurses are on strike? That because nurses are on strike, bring the 78-year, they should volunteer. That's what he said. Retired nurses should volunteer and come and do the work. I mean, I think that is the worst, the lowest of the statements. If he has any dignity, he should come out and apologize for such an embarrassing statement to be made on behalf of a full, proper government of Ghana. That a minister for health says that I'm going to bring retired nurses, just get retired because the nurses are on strike. I think that's very, very unfortunate. But we'll get there. All right. Now, let's see the guy who sits in Amsterdam. Is it Amsterdam or Denmark? He is Mr. Happiness. He put some video up that was also on the platforms that was quite trending quite a bit. So I decided to share with you. So let's see that video from I don't know his name, Kofi Ghana or something like that. Yes. Okay. Have a look at this video.
Minta Akando, Health Minister Ghana. And then who news say, who catch registered nurses and midwives for say, their demand, no, there is no space in the budget for it. Gross disrespect. I didn't hear. More in election, December, more court transition. See the previous government, mamu, everything that was happening under them. Timu say, no money. Registered nurses and midwives for no agreement, even though we implement it. And the agreement is favorable to more mobile power now. I was saying, registered nurses, renegotiate and some of the budget. But Esan said, Moon respected the nurses in Tino. Moon ready budget, and I'm too on demand. And when your guts a catcher will say, there is no space in the budget for them. And the retired nurses and the midwives, retired nurses and midwives, were disrespected the profession of nurses and the midwives of Ghana, including the president John Dramani Mahama. Because 1st July, Oma Tiska said National Day of Prayer. Omo organizing a so far conform. Abedna some Bompire Magana. We said that we almost started some Bompire Magana. Then it's Ghana. Everyday corruption. Yes, about time, Aquaman Probi Hospital. Nurses in Yonti Apama Muso Munkufi. Mupasam we are Nankofu, and Sanamabeka say, Ghana nurses near, but I own Mutrimu didn't say anything. Oh, as a health minister, Obi our friend who say educated, classroom educated. Also, Munyan Sound. Now, Katron will say, Yapamucho. Mudimand no. Previous government, then, Ejitumba, we implement it. Yes, you are buying economy in Entina. Young financial budget and buy a pamucho. Mudiman no. Mama next year, ye be yamamu. At least can who can drop out finance and a not control. Now Baba Katom said there is no space in the budget. Unim so a church of nurses. His Excellency John Dramani Mama. Adia health minister when ye one nurses for Nkasa. Nasa omudiman quarter crown will be nyamom. Mamunyana disaster and Sigan and Uncle Fungu answer. Mamunyana Uncle Fungu once and Amabeka Nama be say nurses, leaders, forget about the politics. Lives are at stake. Moon to me meet demands in the crowd. Moon to me meet a little. Fanny said, treating nurse for demand and say a national disaster NDC. Mobile allocate emergency funds for it. Now more allocate the funds to the nurses. No more go back to Juma. Now life in Crawford lose my life. I want Munsim. Kwamna Mintakando apologize for Asemna Okayano a disrespect to nurses. Ghana nurse, my sorry why? Said that me can't say yampamu. Mukwa mamu meeting with demands. You can't say retired nurses and midwife. Mamu minister na some kind. Mamu mba na say mo betray mo colleague nurses and midwives some you must see. And I heard of the nurses and midwives. Most mamu resume da. Some mo potai. Omo doctors home. Omo hospital no mo nurse juma. Kakra me waka no.
Shouldn't we have an orientation for ministers? Shouldn't we have an orientation? Because a minister for health cannot talk like that. A minister for health says that, oh, government doesn't have money. I'm going to bring retired. I mean, he should be bowing down his head in shame. Total and absolute shame. The president, the vice president, the chief of staff should be reprimanding him tonight. And this is not the first. Look at what he did at Tamale Airport. Go there shouting on doctors, just shouting on them, do that, do that. You think because of politics you can shout on people? What does Minta Akando think politics mean? He doesn't understand that politics is service to people. Minta Akando, he doesn't get it. That politics is service to people. That politics is that he has become a boss, or a boss over who? If we are all going to work at a private company, would they select him as a boss over anybody? That's what he should be asking himself. That's why they call it a privilege. It's a privilege to serve because you, Minta Akando, if we are all going to Unilever, they will not select you ahead of anybody. They will not. But you are a politician. We respect you for that. You have gone into the woods and told people to vote in a certain way, and they have listened to you. So we respect you for that. So when you become a minister of health, you have to understand that you are minister of health as a privilege. You are not clever more than anybody. And you are not. You, Mita Kando, you are not. Don't bring yourself because you are a health minister. You are not clever more than anybody. Minta Kando, you are not clever more than anyone anywhere. Because you are a politician. So we respect politicians. Because they lead the country. But don't abuse that respect and talk anyhow to people. Some of those nurses are better educated than you. Some of those nurses has paid more taxes than you can ever pay. You, Minta Kando, how much taxes have you paid in your life to the Ghanaian GRA? How much taxes have you paid? Some of those nurses that you are talking anyhow about, you, Minta Kando, they have paid more taxes than you will ever pay. You stand up, you become minister, and you think that that's the end of the world? Minta Kando, you think that's the end of the world? Because of what the world has become? Because politics has become so bad? No, take your time, calm down, and know that some of those people are very, very useful to Ghana. Even the amount of taxes they've paid. Some of them have educated 4 children. All the children are doctors. Some of them are single mothers. They've educated 4 children to go through Kolebu Medical School. They have 4 doctors. And you, Minta Kando, you go to Kolebu and shout on specialists because you are the minister. My goodness, that's so bad. Very, very bad. And I hope that President Mahama, this doesn't represent President Mahama's style. We all know President Mahama. This doesn't represent his style. Minta Kando, be very careful. Don't embarrass the president. He has given you an opportunity to serve. That's really what it is called, opportunity to serve. When the president was commissioning them, I was looking for the video. It took us too long, so I left it. Maybe I'll put it on social media. When the president was commissioning his first batch of ministers, including Minta Kando, if you remember, viewers, he said, watch how you talk because now you are ministers. That's what the president said. He was trying to draw a line between the campaign season and the working season. When we come to talk about Mr. Ansansadeli, I'll tell you something about campaign, difference between campaign and difference between managing the government. President Mahama said, you guys that I'm commissioner, Blackwell was there, you, Minta Kando, you were there, Sam George was there, Omani Boama was there. President Mahama told you, now that you have become ministers, learn and watch how you talk. Minta Kando didn't learn anything. He learned nothing. In any other country, tonight he would have tendered his resignation. Any other country, tonight he would have tendered his resignation. Maybe President Mahama will have mercy on him, but I hope they reprimand him. And when I hear him talk again tomorrow, I'm expecting to see a change in demeanor. His very, very demeanor and how he communicates must be worked upon. Don't they have people who train ministers for orientation? And if they don't have anybody, I'm here. They should hire me. I charge X millions for 30 minutes. I will tell them how to talk to Ghanaian people based on the constitutional provisions that sovereignty relies in the people of Ghana. Do they even read the constitution at all? These are our people. Do they read it? The constitution, the fundamental thing said there first, that sovereignty. Sovereignty is the highest authority. That's what sovereignty means. Sovereignty means the highest authority in the land. It says sovereignty relies in the people of Ghana. It is for them. It is held on behalf of them by the government that is elected by them. Then you get elected, you become Minister of Health, and then you are talking anyhow to anyone. Minta Akando. Now, I'm going to play you Minta Akando again. This is Minta Akando speaking in opposition, speaking for nurses, speaking for health workers, as he was ranking member for the Committee on Health. Today, the ranking member for Committee of Health wanted to make a statement. The first deputy speaker said, you cannot make that statement. I've never heard some before. I've never had a situation where there's a nurses strike, the ranking member of parliament wants to make a statement, and the speaker says you cannot make that statement. I'll be showing you that video. That's what they reported to us, that the speaker says he can't talk. I'm not sure what conversations they had before then, but this is what they reported to us.
And the responsibility of this government has become legendary. And so I think that when it comes to matters of health, the government must move with alacrity because it borders on the lives of the people. I am not going into the merits and the demerits of why they are going on strike at the moment. But any reasonable government will engage them and then plead with them whilst they are even at the negotiation table to go back to their hospitals or their facilities. And so, as a matter of urgency, I believe that government must respond to their call and make sure that these health workers are back to the hospital, because already we have a lot of challenges at the health facilities. They are leaving, in fact, they are fleeing from this country because of the economic conditions we find ourselves in. Now, when they take their salaries, they cannot buy anything with it. And so, in a matter of between 2021 to 2023, we have lost not less than 69,000 health workers in this country. And so today, if you go to the facilities, if you go to the hospitals, you wait for hours because there's hopelessness in the system, because there's so much hardship in the system. And that is what government must be responding to. And so for me, the Constitution guarantees every citizen the right to health care. And so they must respond to the needs of the lab people.
That was Minta Akando speaking in opposition. Why, do they take us for granted? Why? What's the problem? They think that we don't know what we're about? So you speak in opposition like this so that you win power, and then you win power and you tell the nurses that we don't have money for you. That your thing you're asking for, it will cost us 2 billion. We don't have money. You don't have money for what? Nurses. But are nurses not a more integral part of the society than minister? Nurses. If there's no minister, the president can do the minister's work. A deputy minister can do the minister's work. Another person can do the minister's work. Nurses. You have to go through training. You don't need training to be minister. Nobody needs a training to be minister. There's no school that trains ministers. So ministers can be done away with. In fact, in any case, under the Constitution, the only minister that the president is obliged to name is under Article 88. You can check. It's only in Article 88 that a minister has to be definitely named by the president. That is to say, it's only under Article 88 that the president cannot assume that responsibility of that minister, because the Constitution identifies. The Constitution doesn't identify a minister for finance. The Constitution doesn't identify a minister for trade. It does not identify a minister for... That is why one president can have 100 ministers and John Mahama can have 60 ministers. If I become president, I have 20 ministers, because it's just the way I name them is the way it doesn't matter. So ministers are not, they can be shifted. But the nurses, they are giving injection to children. They are doing polio immunization in the communities. They are the cheap compounds. They are helping Ghanaians to live. When you see traffic, people going to work every day in traffic, say thank you to the nurses. Now, if the nurses are not there, go and look at the traffic situation. It will reduce because people are sick. They go to Kolebu, they have to go to lab, they have to pass here. Everything is health workers. You, Minister of Health, if you are not in Ghana for 2 months, we will not even know. When you travel and you are spending taxpayers' money and buying business class tickets that some ministers couldn't buy in private life, they become minister, they can buy business class tickets because the taxpayer is buying it for them. That's when they can buy business class, when the taxpayer is paying for it. And then you will not humble yourself and notice that you are in a privileged position to serve. You don't even notice it, that you are in a privileged position to serve. What happened to Ghana? Our former ministers were not like that. Do you remember Mrs. Brookman Emisa? For those of you who are my age, do you remember Brookman Emisa? Do you remember Major Courage Koshiga? These were health ministers who know how to talk and know how to respect people, not Minta Akando. He must be ashamed of himself. A health minister talks like this, that I'll go and bring back. Oh my goodness. He should go and read the platforms. On the Presec platform, he should go and read it. What people were saying about him. He should go and read that this other one was brutal. He should go and read it and see how Ghanaians are angry with him. When we give you a privileged position, this is what you come and do. And this is Minta Akando speaking in opposition. Oh, the nurse's salary is small. Since 2021, they have not been paid. Then you become minister, and this is what you do. Lalai Baba. Okay.